Imagine that chemical that spent 80 years to sitting on lab shelves. I mean, it was a totally unremarkable industrial solvent. And then one day, just by pure dumb luck, it's revealed to be one of the most powerful neuropsychiatric drugs we have ever discovered. So how did this humble solvent become this cornerstone of modern neuroscience? Well, let's dig in.
So our story starts, not in some high-tech pharmaceutical lab, but really with a simple, overlooked chemical and just a stroke of pure chance. This is a story of valproic acid's accidental discovery.
Okay, just take a look at this timeline. Valproic acid, or VPA, was first made way back in 1881. And for 80 years, it was nothing more than a chemical tool, a simple solvent. Can you imagine that? For decades, labs all over the world were using a future blockbuster drug just to dissolve other stuff in their experiments. Then, in 1963, a researcher testing a completely different compound noticed something. Well, bizarre. His lab animals weren't having seizures like they were supposed to. And it turned out, the miracle cure wasn't the new drug he was testing. It was the plain old solvent he was using to deliver it. A complete and total accident that would go on to change millions of lives.
So we've got this accidental discovery. What does it actually do inside the brain? Well, it turns out VPA acts kind of like a master key. It's able to calm down our neurological systems in several different ways for several very different conditions.
And this is exactly why people call VPA a broad-spectrum medication. For epilepsy, it's not just for one type of seizure. It works on a whole range of them. For bipolar disorder, it's one of the go-to treatments for stabilizing those acute manic episodes. And for people with chronic migraines, it can seriously reduce how often and how severe those attacks are. So just think about that. You've got the uncontrolled electrical storms of epilepsy, the extreme mood swings of bipolar disorder, and the debilitating pain of migraines. 3 completely different problems, all responding to the same drug. The question is, how?
Right. How can just one molecule be an effective treatment for such different conditions? Well, the answer lies in its amazing ability to influence one of the brain's most fundamental chemical systems.
Let me introduce you to GABA. You can think of it as the brain's primary off switch. So while other neurotransmitters are hitting the gas, telling your neurons to fire, GABA is doing the exact opposite. It's telling them to calm down, to chill out. It's literally the brain's natural brake pedal that keeps everything from just spinning out of control. And VPA, well, it doesn't just tap on those brakes. It pretty much overhauls the entire braking system.
And this right here is VPA's brilliant, 3-pronged strategy. First off, as you see in step 1, it plays defense. It protects the GABA that's already floating around by blocking the enzyme that normally cleans it up. Second, in step 2, it goes on offense. It stimulates another enzyme that basically runs the GABA factory, telling it to produce even more of the stuff. And then finally, in step 3, it amplifies the whole signal, making your brain cells way more receptive to GABA's calming message. It's a total system upgrade for the brain's braking power.
But boosting GABA is only part of the story. VPA is also like an insulator for the brain's wiring. It blocks specific sodium channels to prevent that rapid, uncontrolled electrical firing that causes seizures. And on top of that, it also limits the flow of calcium through other channels, which is crucial for stopping other types of seizures. So it's calming the brain down both chemically and electrically. It's a double whammy.
Okay, so a drug this powerful and this versatile, it's almost unheard of. It sounds almost too good to be true, right? Which of course leads us all to that inevitable question. What's the other side of this coin?
And this brings us to that other side. Because with a drug this powerful, the risks can be just as potent as the benefits. This is where we get into the high-stakes trade-off of valproic acid.
Let's start with the more common stuff. A lot of patients experience things like nausea or indigestion. Significant weight gain can be a really big issue for some people. Then you've got things like tremors, hair loss, or just this persistent feeling of being drowsy. And while some people can manage these, for others, they can be serious enough to really impact their quality of life.
But the concerns go way, way deeper than that. VPA carries multiple black box warnings from the FDA, and you need to know that is the most serious alert the agency can possibly issue. It means the drug carries a significant risk of serious or even life-threatening side effects.
The FDA points to 3 major life-threatening dangers. First, severe and sometimes fatal liver damage, and this is especially a risk in young children. Second, a sudden and very dangerous inflammation of the pancreas, which can happen at any time. And third, a severe risk of causing birth defects if it's taken during pregnancy. And it's this third risk that really demands our attention.
The risk to a developing fetus isn't just a small chance, it's profound.
Exposure to VPA during pregnancy is linked to a really high rate of major birth defects, things like neural tube defects, and it's also been shown to result in children with lower IQ scores later in life. This risk is so well established now that it has completely changed how this medication is prescribed for any woman of childbearing age.
So all of this brings us right to the central challenge of using valproic acid. It is a constant, high-stakes balancing act between the medication's absolutely immense benefits and its equally immense risks.
So why is this balancing act so tricky? A huge part of the answer is right here. So picture VPA molecules in your bloodstream like passengers on a bus. About 90 to 95% of them are bound. They're sitting in seats, attached to proteins, and they can't really do anything. It's only that tiny 5 to 10% that's free, the ones standing in the aisle, that can actually get off the bus and go do their job in the brain. Now, if another drug comes along and kicks some of those passengers out of their seats, or if you take just a slightly higher dose, the number of free, active molecules can skyrocket, really quickly turning a helpful dose into a toxic one.
And that sensitivity creates what doctors call a narrow therapeutic window. All that means is the gap between a helpful dose and a harmful one is incredibly small. The target is between 50 and 100 micrograms per milliliter. If you go just a little bit below that, it might not work. If you go a little above, it can become toxic. It's like walking a tightrope, and that's why patients on VPA need constant blood monitoring to stay safe.
And this quote from our source material really just sums it all up perfectly. Using VPA isn't a prescribe it and forget it kind of situation. It has to be a partnership between the doctor and the patient, and it's all centered on constant monitoring and education just to navigate that razor-thin line between relief and risk.
Ultimately, the story of valproic acid is this powerful case study in the toughest decisions that face modern medicine. And it leaves us with one of medicine's most profound questions. When you're faced with a drug that can save a life, but also has the potential to cause devastating harm, how do we ever truly know if the reward is worth the risk?